Hey everyone, and welcome back to the channel. Today, we're diving deep into a nutrient powerhouse that plays a crucial role in so many aspects of our health, vitamin A. From crystal clear vision and glowing skin to a robust immune system and healthy growth, vitamin A is a true multitasker. But what exactly is it? Where can you find it? And what happens if you don't get enough? In this comprehensive guide, we'll explore everything you need to know about vitamin A. We'll break down its different forms, uncover its incredible benefits, reveal the best dietary sources, discuss the risks of deficiency and excess, and detail the recommended dosages for various groups. So, grab a seat, and let's get started. What is vitamin A? The basics first things first, what exactly is vitamin A? Well, it's not just one single compound, but rather a group of fat-soluble retinoids, including retinol, retinol, and retinoic acid. These different forms play distinct roles in the body. Retinol, found in animal products as the active form of vitamin A. Beta-carotene, found in many colorful fruits and vegetables, is a provitamin A carotenoid, meaning our bodies can convert it into retinol. Being a fat-soluble vitamin means that vitamin A is absorbed with dietary fats and can be stored in the body, primarily in the liver. This is important to keep in mind when considering both intake and potential for toxicity. The incredible benefits of vitamin A. Now, let's talk about the amazing things vitamin A does for our bodies. Its benefits are truly wide-ranging. Vision, perhaps the most well-known role of vitamin A, is in maintaining healthy vision. It's a key component of rhodopsin, a protein in the retina that helps us see in low-light conditions. Deficiency can lead to night blindness and, if left untreated, even more severe vision problems. Skin health. Vitamin A plays a vital role in cell growth and differentiation, including skin cells. It helps keep the skin healthy, radiant, and can even be used topically in the form of retinoids to treat acne and signs of aging. Immune function. Vitamin A is crucial for a well-functioning immune system. It supports the production and function of white blood cells, which are essential for fighting off infections and diseases. Growth and development. For children and adolescents, vitamin A is essential for normal growth, bone development, and cell differentiation throughout the body. Cell communication and gene expression. Vitamin A also plays a role in cell signaling and gene expression, influencing a wide array of bodily processes. Now, the million-dollar question: where can we get this vital nutrient from our diet? There are two main categories of food sources: preformed vitamin A, retinol. This active form is found in animal products such as liver, which is a particularly rich source, dairy products like milk, cheese, and butter, eggs, and fatty fish like salmon and tuna. Provitamin A carotenoids, beta-carotene. These plant-based pigments are converted into retinol in our bodies. Excellent sources include orange and yellow fruits and vegetables like carrots, sweet potatoes, pumpkin, and cantaloupe, as well as leafy green vegetables like spinach and kale. It's important to note that the conversion of beta-carotene to retinol isn't always perfectly efficient and can be influenced by factors like individual metabolism and the presence of dietary fat. Vitamin A deficiency, risks and symptoms. While vitamin A is stored in the body, prolonged inadequate intake can lead to deficiency. This can have significant health consequences, especially for children and pregnant women. Some common symptoms of vitamin A deficiency include night blindness, nyctalopia. Difficulty seeing in low light conditions is often one of the first signs. Dry eyes, xerophthalmia. This can progress to more severe conditions like Betos spots and corneal ulceration if left untreated. Dry and scaly skin. The skin may become rough, dry, and flaky. Increased susceptibility to infections. A weakened immune system can lead to more frequent and severe infections. Impaired growth and development in children, vitamin A is crucial for proper growth. Infertility, in both men and women, vitamin A plays a role in reproductive health. Certain populations are at a higher risk of vitamin A deficiency, including individuals with malabsorption disorders, those with very restrictive diets, and people in developing countries with limited access to diverse food sources. Vitamin A toxicity: can you have too much? Because vitamin A is fat-soluble and can be stored in the body, it's also possible to have too much, leading to vitamin A toxicity, also known as hypervitaminosis A. Symptoms of acute vitamin A toxicity, often from a very high single dose, can include nausea, vomiting, headache, dizziness, and blurred vision. Chronic toxicity, from prolonged high intake, can lead to more serious issues such as skin changes, dry, itchy, or yellowing skin, hair loss, bone and joint pain, liver damage, increased intracranial pressure, birth defects. High doses of vitamin A during pregnancy can be harmful to the developing fetus. It's important to note that vitamin A toxicity is generally associated with high intake of preformed vitamin A from supplements or animal sources, particularly liver. It's much less likely to occur from high intake of beta-carotene from plant-based foods, as the body regulates its conversion to retinol. However, very high beta-carotene intake can sometimes lead to a yellowing of the skin, a harmless condition called keratonemia. Vitamin A supplementation: should you take it? Given the importance of vitamin A, you might be wondering if supplementation is necessary or beneficial. For most healthy individuals with access to a balanced diet, vitamin A supplementation is generally not required. Focusing on consuming a variety of vitamin A-rich foods is usually sufficient to meet your needs. However, in certain situations, a doctor might recommend vitamin A supplementation. This could be in cases of diagnosed deficiency, certain medical conditions that affect absorption, or for specific populations under medical guidance. It is crucial to consult with your doctor or a registered dietitian before taking vitamin A supplements. They can assess your individual needs, and determine if supplementation is appropriate, and at what dosage. Taking high doses of vitamin A without medical supervision can be dangerous. Recommended daily intake of vitamin A. Now, let's talk about how much vitamin A we actually need. The recommended daily intake varies depending on age, sex and life stage. Here are some general guidelines. Infants, 0 to 6 months, 400 micrograms Re, adequate intake. Approximately 1,333 IU. 7 to 12 months, 500 micrograms Re, adequate intake. Approximately 1,667 IU. Children, 1 to 3 years, 300 micrograms Re, 1,000 IU. 4 to 8 years, 400 micrograms Re, 1,333 IU. 9 to 13 years, 600 micrograms Re, 2,000 IU. Adolescents, males, 14 to 18 years, 900 micrograms Re, 3,000 IU. Females, 14 to 18 years, 700 micrograms Re, 2,333 IU. Adults, 19 plus years, males, 900 micrograms Re, 3,000 IU. Females, 700 micrograms Re, 2,333 IU. Pregnancy, 14 to 18 years, 750 micrograms Re, 2,500 IU. 19 to 50 years, 770 micrograms Re, 2,567 IU. Lactation, 14 to 18 years, 1,200 micrograms Re, 4,000 IU. 19 to 50 years, 1,300 micrograms Re, 4,333 IU. These recommendations are generally for total vitamin intake from both food and supplements. As we discussed earlier, it's usually best to aim to meet these needs through a balanced diet. Remember that these are just general guidelines. Your individual needs might be different. Always consult with your healthcare provider or a registered dietitian for personalized advice on your vitamin intake. Key takeaways and recommendations. So, to wrap things up, here are the key takeaways about vitamin A. It's a group of fat-soluble retinoids essential for vision, skin health, immunity, growth, and more. We can get it from both animal sources, preformed vitamin A, and plant sources, provitamin A, carotenoids. A balanced diet rich in colorful fruits, vegetables, and animal products is usually sufficient to meet our needs. The recommended daily intake varies by age, sex, and life stage. Refer to the guidelines discussed. Vitamin deficiency can lead to serious health problems. Excessive intake of preformed vitamin A can be toxic. Consult your doctor before taking vitamin A supplements. Thank you so much for joining me today on this deep dive into vitamin A. I hope you found this information helpful. If you did, please give this video a thumbs up, subscribe to the channel for more nutrition insights, and let me know in the comments below if you have any questions. Outro and call to action. Remember, a balanced and varied diet is the best way to ensure you're getting all the nutrients your body needs. Stay healthy, and I'll see you in the next video.